Do you think that this really is a catalyst for real change, or do you think it's still people just paying lip service to improving indoor air quality?
Well, it depends where, because this is really now down to the individual countries. This is not a global change. Even so, global change is still, well, there's still one more step to do this in terms of a global change. It is still better WHO briefing or recommendations, because this is ultimately what the world listens to, and the national public health authorities. And the current briefing is from the 30th of April. And the way it words this, the modes of airborne transmission, the first dot point is that the main mode of transmission is, however, the wording is but short distance, or most infections occur over short distance, that 1 meter. It doesn't specify, well, really which mode it is, whether it's inhalation or whether it's, but it's that 1 meter. And then the second dot point is that the infections can also occur in crowded and poorly ventilated places. But then at the end of this dot point, it's still that 1 meter. So, well, okay, they can also occur, but this gives the way out of to public health authorities. If the main mode of transmission is that 1 meter, and since they've already not that much mandated, but recommended that physical distance of 1.5 meter, like in Australia and different countries is different, so means that they've already taken care of the main mode. Nothing else, isn't it? Just stay apart. And then this poorly and crowded ventilated spaces, well, public health authorities can always claim that the majority of our places in Australia are not crowded and poorly ventilated. This is really relative, because I'm saying often, I'm now at home, but in my office at QUT, which is a small office, but still 3 people can comfortably sit spaced physically. And with 3 people there, with mechanical ventilation, this is crowded and poorly ventilated place, judging by the concentration of CO2 meter. So this is still, WHO still should say very, very clearly, and WHO still avoids the wording airborne transmission. Now, the argument could be that they have all kinds of other documents. So there's the roadmap for ventilation in the context of COVID. There is a document about aged care facilities, a few others. So one may say, okay, there are all these documents. But then if you put yourself in the shoes of minister or Ministry of Health, they're not going to start reading all the different documents about ventilation. Ventilation is not their business, or aged care facilities, whatever. Question is airborne transmission a health issue or not? And if this is not clearly stated, there's a way out of this. Therefore, in Australia, no public health authorities, certainly not federal, clearly stated airborne transmission is a risk which must be mitigated. So this is still what the WHO needs to do. But regardless of this, in different countries, actions has been taken. It depends in what countries. So they've been recommendations of this nature, that nature, and startups. I'm still planning to sort of get the group together and take stock of what happened where. Now, whether these are changes which will stay, or changes which I compare to the situation of putting a bucket under a leaking ceiling during a storm instead of fixing the roof, that's the question mark. Like, for example, in the Victorian Department of Education announced, that was a few weeks ago, announced a package of measures. Among this is buying whatever number of thousands or tens of thousands of air purifiers for the classrooms. Well, all right. This is putting a bucket under the leaking roof, because really ventilation needs to be fixed, and if ventilation with proper filtration when necessary, But if nothing is available, okay, put that air purifier. But in a few years from now, in a year from now, nobody will be using air purifiers for all kinds of reasons. They will just go to junk and will create electronic junk. So, so this really issue is that whether something will change, but for something to change, national standards, each country's national standard have to change. If national standards wouldn't change, including, and we are talking about standards, building codes, indoor air quality standards, including specifically health in building codes and infection transmission, nothing's going to change. This is the reality.
Have you seen any countries that have taken some real leadership in this area and enacted standards that you think are appropriate?
I think Germany has, and Germany has started working on this quite early in the piece. Already last year, they had serious grants in order to improve ventilation. There was nothing mentioned about air purifiers or anything like this, but improvements in ventilation, and they listed quite a number of different spaces. Now, to what extent it is to improve ventilation, to what extent it is backed by standards, this is something I don't have a full understanding, because standards normally, changing standards is normally a very lengthy process under any circumstances in any country. So it's not like this, okay, change standards. It's always a discussion about this committees and so on. So so one could say that there hasn't been really a time to change the standards. So and now we are talking about the kind of things which happen behind closed doors. For example, I've heard that there are some discussions here within the circles involved with the National Building Council of Australia, but whether these are rumors, whether they are really working on something and something will emerge, it's impossible to tell. So without really going deeply into understanding of what has happened in individual countries, it's very difficult at this stage to say what's permanent and what's just putting that bucket under a leaking roof.
So when I go back to work, hopefully in the next month, back into the office building, it's a, I don't know, 50-story tower in the central business district of Melbourne. We don't have any windows that open to the outside. We have, fortunately, an air purifier in the office, but what can these built office environments do to protect workers?
Well, if this is a mechanically ventilated building, and by the description, what you were saying, it is a mechanically ventilated building. So, and particularly of this size of the building, there's got to be engineering team of somebody who manages this. And in principle, they should know what is the ventilation rate, which is set up for individual areas. Now, they should also be able to tell whether this actually is, whether actually ventilation in all the areas is according to what they assumed, which probably is not, just judging by the simple fact that the temperature is the easiest parameter to measure, to set, and to sense. And how many times, well, in my office it's cold and next door is too hot because they can't balance the temperature. Well, everybody has this experience. So if the parameter we can sense, the control, the engineers can't set properly, what confidence it is giving us that the ventilation is working. So in this case, we cannot rely on what they are setting, what they think is happening. Measurements have to be done. And the simple first measure is on CO2 concentration. Now, this is a bit more complicated that it appears in mechanically ventilated spaces. Because, like for example, here it's window open and I have this CO2 meter here. It's showing slightly over the background, well, which is still, despite everything, open, but maybe it's up there, so my breath goes there, but it's still slight. So anyway, anything what happens directly translates into this reading. However, if you are in a mechanically ventilated area where air is recirculated, which means it should also go through filters. So, but filters remove particles and possibly the virus or viruses, but they don't remove CO2 unless there's sufficient in the supply air, sufficient outdoor air. So then we are slightly losing this direct relationship between the concentration of CO2 and the infection transmission. So it may be that CO2 is elevated because it's recirculated. Nevertheless, particles are filtered, which obviously doesn't help to simply explain this situation. But well, still, if CO2 is too high, there's a problem because it shouldn't be. It means that in any case, even if the infection risk is lower, still it's not right because it affects our performance. It affects we are sleepy and tired if CO2 is too high.
I saw on the Osage website, it's got some really great stuff. And I saw on the Safe Indoor Air for Kids diagram, which maybe you had something to do with. It gives under CO2 monitors, it gives like the low relative risk, moderate relative risk, etc. I'm assuming that all of these kind of levels are kind of universal. It's not just for safe air for kids. It's safe air for anyone, really. Is that the case?
That's right. Yeah. This is for schools because schools are the main interest. The main interest in Victoria. It's now an interest also in New South Wales. I don't think anywhere else in Australia, and no other environments are of any interest to anybody in Australia because only the Department of Education started doing something about this. So of course this is relevant to every office, to every public buildings where we are, and of particular significance are catering places. Because, well, first of all, even if masks are mandated anywhere else, not in the restaurants for obvious reasons. Many restaurants have just natural ventilation, which means no ventilation, if it's cold or if it's hot, and then the split system air conditioner is going and just turning things around. And we spend there hour, 2 hours, whatever, full room, perfect conditions for outbreaks, and how many outbreaks occurred in restaurants. So this should certainly be targeted. This is even more higher risk than in offices, because in offices we are more spaced. We are not. It's not usually not as crowded as it is in the restaurants. So and usually in mechanically ventilated buildings, it would be better. Restaurants are, but no one is talking about restaurants whatsoever.
I thought they actually were in New York and some cities where they were actually they were measuring CO2 levels and are you familiar with anything in certain cities where they are starting to take this seriously?
Oh yeah. Instead, my comment was in relation to Australia, to the situation in Australia, because I think we are really behind the rest of the world. Yes, there are in New York there is a website. I had it somewhere, but I could possibly find it, where people are encouraged to to take CO2 monitor like this, and then put on this website their readings. Now there was some discussion to what extent this is. It's not about the ethics, to what extent this could be challenged, because let's say you put a restaurant and whatever restaurant and the name of the restaurant and high concentrations, and let's say that your monitor didn't work properly, so you put bad name to that restaurant, so potentially the restaurant can sue you. So this were that kind of discussion what to do, but as I understand it, I've seen a whole map of this. I've seen this in the news, Spanish news. They were showing things like this in some restaurants in what is Madrid or Barcelona, one of the Spanish cities. In Belgium, CO2 monitors are also used quite widely, and they are mandated in some environments. So this is happening in other places or in other countries.
And you obviously welcome this level of interest?
Oh yeah, well, I say that there should be a CO2 monitor on the wall of every public space. And this is not something exotic, because it was, I might have mentioned this to you on some previous conversations, what I saw in Germany some years ago. You don't remember? Yeah, maybe not. A good few years ago, I was visited a colleague in a research organization in Germany. Well, there was a big spacious room, high ceiling, mechanical ventilation, little window open, just 5 of us spaced. So it looked that ventilation would have been good. Not that I thought about this for a second. But then there was on the wall this quite large size, not like that small, quite large monitor, CO2 monitor. So the concentration, but also the traffic lights, green, yellow, and amber. And I was looking at this and I was really transfixed to this, because I realized how quickly this concentration goes up, and from green to yellow, and then red, top yellow close to red. And I was thinking, wow, if I was asked about ventilation in that space, I would have thought that it was good. I will send you that slide with this, because I've been using it well before this pandemic. And then they said, well, these monitors are used commonly in German schools to tell teachers and students what's the ventilation. So we are discovering something like it is something out of this world, discovered during the pandemic. In Germany, it was used years ago and for this purpose. So
I was just going to say that's intriguing. I wonder what got them doing this. What was the catalyst for them to do that?
Well, Germans are very pragmatic people, and they just pragmatically listen to science and technology. They know that if CO2 concentration is high, kids are sleepy, lethargic, and they are not progressing, ventilation is needed. This is not new science. We've known this for, I don't know, a century, more than a century. So it is not why Germans are doing this. Why we are not doing this? This is the question.
Yeah, I think it is interesting, though, that Germany has, at least for a short time more, a chancellor who is a scientist.
This certainly helped as well. This certainly helped as well. But the fact that the chancellor like this was in Germany is just the credit to the Germans' approach to things. So I don't think it's a coincidence that.
Are you talking to the air conditioning and ventilation industry? You know, are you giving advice to the people who are going to be planning new buildings and indoor spaces about this sort of stuff?
Well, I'm receiving daily about 10 emails from different sectors of the industry. Not that they are asking me for much. They would be very happy to talk about their products and so on. The issue really is not just to talk to these people, because these industries will not do absolutely anything if there's no change in standards. The problem is that if they were to add something extra, which would cost even $100 more, whoever is the developer and pays for this would not agree to this cost. And I give you an example, which I probably wouldn't have paid much attention to this before, but now I do. We have a little unit in the Sunshine Coast. That unit is rented as part of the complex of 20-something units, but we quite frequently go there. And they were changing the windows because there were some issues with old windows. So we came after this change of the windows, and I can't open the window. The window opens in just this much. And there's some bolts stopping the window from opening. So, my interpretation was that they didn't finish this because the curtain wasn't hung. Okay, so that there's still work in progress. But then I went to the manager and asking what's happening. Oh, no, this is according to the standard. What do you mean according to the standards? According to the standards, because this apartment is more than 4 meters above the ground. And according to the standards, and I'm not sure whether these are just Queensland standards or national standards, is that if anything is above that high, it has to have a protection against falls, because, well, anybody, particularly children, can fall out of the window. All right. Now, but there are different means of protecting against falls. You can put a screen, like a metal screen here, which also serves a purpose against mosquitoes, and then no one will fall. Or there are certain mechanical guards, which would do this as well. But this screen costs, I don't know how much, costs $100 or what. The guards cost also. So the cheapest way is just to block the window such that the opening is that small that a child head wouldn't go through this. The bolt costs next to nothing. And voila, problem solved. No one will fall out. The fact that you block the window and there's no ventilation, who cares? Well, that is as simple. So talking to the architect, talking to the people who are doing this, is pointless. They will not do anything which costs. It has to be standards which change.
Yeah, right. That's interesting. Okay, do you have any suggestions for which companies are going to benefit from the increased interest in measuring CO2 and purifying air, things like that?
Well, just simple Google who are the manufacturers, and you'll know who will benefit. That's very simple. There was actually in the May issue of the Choice magazine, there was a review of air purifiers, which they always do a good job in reviewing this. So it will tell you which companies, which devices are recommended and which companies.
Okay.
But now most of these manufacturers are overseas manufacturers. Like there's a really little manufacturing taking place in Australia. But in general, if we are serious with the new standards, with the new approach, this would benefit the whole Australian industry, building industry, architects, and so on. This would be a completely new economy of this. It's that perception that this will cost. This will create new economy for health. But we are looking at this. This is just going to be a cost and nuisance.
Yeah, but when you also look at the savings of productivity, if you have less absenteeism, because the things that we do for COVID are going to be protective against influenza and rhinovirus and extensively drug-resistant tuberculosis, many things.
Yeah. Well, in our science paper, when we were finishing this paper, the editor wanted as much as possible to prove economic proof. There hasn't been a lot of economic analysis like this, but one which we've quoted there was that that assessment that the initial cost of lowering the infections and so would only add 1% to the building cost. But the cost of the, that was in the US, but the cost of respiratory infections, and then again in the US, put together influenza and other respiratory infections, they would add up to about $50 billion a year. Of course, not all of them would have been prevented if ventilation was good, but let's say that half. Well, still, we are talking about a huge number compared to that 1% of initial cost. But the problem here is that the money comes from different pockets. So someone else pays for the building, the developers for the buildings, and someone else pays for the costs of infections. Well, for the cost of infections, we are all paying through taxpayers' money. We are individually paying if we are sick. Absentees, all the companies, institutions are paying if the workers are not working. So the costs are dispersed and someone else is paying for this. So that's also part of the problem. And for the politicians, the problem is that any improvements will not be seen during this term of the office. And the time scale for the politicians is this term in the office. So that's another complexity of this.
Yeah, exactly. Lydia, I have to go in 4 minutes. I'm just wondering if Kaneko, if you have any questions for Lydia.
Hi, I have a question. I mean, I guess in future, like, I don't know about the situation in Australia, but in Japan, anyways, like some of the schools are doing sort of like, how to say, like spreading people, like when would be the timing that the entire classroom will be able to come back to the to school and have a proper ventilations? And if that was to happen, what is the ideal model in your opinion?
Well, it's not just an opinion. We are finalized. Well, we've published a few papers on this topic, and this is sort of the next level of assessment, risk assessment. Yeah. And for risk assessment, we take into account the infection risk, and the infection risk we take into account the ventilation, the time of exposure, the level of vaccination, and all the factors we can take into account. And based on this, we calculate at which point R0, which is the reproductive number, will be below 1, because that's basically, doesn't mean that there wouldn't be any infections, but R0 would be below 1. So such analyses are possible, available, if anyone wanted to do this, which at the moment not seem to be very high interest in public health authorities or any authorities. I can send you that paper or the link to the paper.
Cool. All right. Well, we'll let you go. Thank you so much, Lydia. It was great to see you, and congratulations again.
Thank you. Good talking to you.